Good morning. My name is Amol Nirgotkar. I'm the CEO of Patient Prism, and we are here at the Dykema DSO event in our makeshift studios at Patient Prism and Dykema. And I'm here with Ray Scott, who is Dr. Ray Scott,
Yes.
who is the Vice President of Clinical Development at one of the amazing DSOs, American Dental Partners. And welcome to our show.
Thank you.
I want to tell us about what you guys are doing in the space right now, what's exciting to you guys, and you guys are growing quite a bit.
Sure,
So
yeah.
talk to us about the American Dental Partners model.
I think one of the big things for us that kind of makes us different than others, I know that everyone thinks that they're different than everyone else, but we really strive to focus on that, the patient management piece of it, as it relates back to quality of care, and trying to grow in the space, as you said, and differentiate ourselves from others. One of the key things I think that we do that's a little bit different than everyone else, we focus on the clinical side, and we talk more about group practice than we do probably the DSO or that thought. We've been around since 1995, so we're one of the older organizations out there. But moving forward, we have that more of an arm's length model with our affiliates, and we think that also creates a bit more doctor autonomy, and that's certainly different in this space.
But how about when you create autonomy? It also leads into everybody being the chief, right?
Sure.
And you have to still get economies of scale.
Yes.
So you're still helping them with the support services.
Absolutely.
Right?
Yeah.
But giving obviously clinical autonomy is obviously the name of the business, right?
Yes.
A doctor decides everything.
Yep.
But at the same time, what you say is very interesting because clinical focus, at the end of the day, what you guys are in the business of delivering healthcare.
Definitely.
And if your dentistry you do is not up to the best, then everything else doesn't.
It's very secondary.
Secondary.
Yes.
And that's great to know.
Yep.
The focus on clinical excellence. And I think what I've learned in my years in dentistry is that doctors strive for that too. Doctors strive for mentorship. Doctors strive for being best clinically. That's what they're trained for. They're not trained really to
do all
run
the
a
other
business.
do all the other stuff.
Right.
Yes.
And you take care of that.
Yep.
Really well.
Yeah. But you mentioned something as it relates to that autonomy. That is one of our absolute strengths as an organization. It's also one of our more challenging things at times, particularly when we're talking about economy of scale, as you speak to. Let's say American Dental Partners goes out and they create some kind of fantastic purchasing opportunity with some vendor. The doctor groups may or may not agree with that, right? And so that gets back. We not only have doctor autonomy at the highest levels in the organization, but also at the chair, which is what you were speaking about. The dentistry is only as good as the doctor that does it.
Absolutely.
We want to create an environment where the doctor can provide great care, but that sometimes gets us into that autonomy piece. Sometimes gets us into some challenging situations.
So, what is your message really to individual doctors or small groups that are looking to affiliate themselves with a strategic partner like yours? What's your message to them right now, and in this chaotic environment?
Well, definitely. Do you want to be a part of something that has a legacy that's been around, that's built to last, or do you want to be a part of something that is maybe a little bit more cookie cutter, kind of historically? We're someone that is built to last because we've been around, we've stood the test of time.
Right.
We have great systems in place. We have tremendous value add from what American Dental Partners brings us.
Sure.
And I was on the clinical side leading a doctor group for 20 plus years with American Dental Partners.
Nice.
So I understand that part of it too, in the day-to-day challenges. But if someone is interested in talking with us about a potential affiliation, we'd love to visit with them.
Absolutely.
And I think that you got to kiss a lot of frogs to find that right prince, and I think that in some cases that is something that everyone needs to do because this isn't right for everyone.
And the fit's got to be on both sides.
Absolutely,
right? Absolutely. And I really appreciate this conversation because I think A lot of people are thinking about this,
Mhm.
and I think they're going to enjoy your conversation and your emphasis on clinical development. So appreciate your time, sir.
Thank
today.
you so much. I appreciate it.
Absolutely. We'll talk soon.
You bet.